Today we are going to discuss about a very important topic, that is shock. Now, the first thing which I want you to know is what is the definition of shock. Shock is a systemic state of low tissue perfusion that is inadequate for normal cellular respiration, right? It is hypoxia at the cellular level and there can be various causes of shock. Now, the classification of shock. There are numerous ways to classify shock, but the most common and most clinically applicable is one based on the initiating mechanism. So the first is hypovolemic shock, second is cardiogenic shock, third is obstructive shock, fourth is distributive shock, and fifth is endocrine shock. The first one which we are going to talk about is hypovolemic shock. So hypovolemic shock is the most common type of shock. Hypovolemic shock is due to a reduced circulating volume, and hypovolemia may be due to the hemorrhagic or non-hemorrhagic cause. Discussing about the hemorrhagic shock, it can be of different types. You can either have concealed hemorrhage or there can be revealed hemorrhage. Revealed hemorrhage is obvious external hemorrhage such as exsanguination from an open arterial wound or massive hematomesis from a duodenal ulcer. So you could actually see blood loss happening, and that is revealed bleed. The other one is concealed hemorrhage. Concealed hemorrhage is where when you can't see that blood loss is happening, but it is accumulating somewhere in body. It can be concealed within the chest, abdomen, pelvis, retroperitoneum, or in the limbs with contained vascular injury or associated with long bone fractures. So another thing which I want you to remember, that bleeding can either be an arterial source of bleeding or it can be a venous source of bleeding. Now, arterial, you can have two types of injuries. Either there can be transection of artery or there can be a laceration of artery. Transection means it is completely cut into two pieces, and laceration means there is just a major cut over the artery. Now, which one is going to bleed more? Laceration of artery bleed more as compared to the transection. The question is why? Because when it is transected, we studied in pathology that whenever there is a vessel injury, the first response is vasospasm. There is spasm of the artery, right? So the vasospasm will reduce the bleeding. Whereas when there is a laceration, because of the spasm, the opening increases and there is more bleeding. So remember that a lacerated artery bleeds more than a transected artery. Okay. Now venous bleed. It is a gradual ooze. So because it is a gradual ooze, more time for body to compensate. So the body's mechanism, the physiology can recalibrate and can adjust to that blood loss. So patient with venous ooze will present very late when the blood pressure suddenly drops. Now let's talk about hemorrhage. So what are the various type of hemorrhages which we should know about? We can have primary hemorrhage, we can have reactionary hemorrhage, and we can have secondary hemorrhage. Primary hemorrhage is hemorrhage occurring immediately due to the injury or surgery. Now, second one is reactionary hemorrhage. Reactionary hemorrhage can occur within 4 to 24 hours post surgery. So, what are the causes of reactionary hemorrhage? It is usually due to dislodgement of clot by resuscitation, normalization of blood pressure, and vasodilation. Reactionary hemorrhage may also be due to technical failure, such as slippage of knots or ligature. Now, the question is, which knot can slip easily? Yes, if we use a Granny's knot, then it can slip and it can give rise to a reactionary hemorrhage later on. During a surgery, we maintain the blood pressure at a lower range than normal so that we can have bloodless feed during surgery, right? So, if we suture at the low blood pressure and then the blood pressure rises in the post-operative period, then the small vessels can start bleeding later on. Which is why a surgeon, before starting any surgical site, range the blood pressure close to the baseline blood pressure. Okay. Now, the last one is secondary hemorrhage, which occurs after few days, like 7 to 14 days. And this is usually occurs because of sloughing of the vessels. Sloughing of the artery or vessels is usually secondary to infection or pressure necrosis, such as from a brain or malignancy. So these are the three type of hemorrhage which we should know about. Okay.